There's a lot to cover today. I'm really excited about today's video. I'm going to talk about things that are normal and things that are not normal when you're new to dentures, because having this channel gives me a unique insight into the experience, and I've seen it all over the place. People who are in panic mode over something that's entirely normal that most people experience, but they don't know what they don't know because this is new to them. They don't know that the things that they're going through are totally common and a normal part of the experience of having dentures for the first time. But then on the flip side, I see people that are, talking about things as if they're normal, and it's like, yeah, you should probably go get that checked out. So I'm going to be going over some of the common things that you'll experience as a new denture wearer, and then some red flags that you might need to get some stuff checked out. I want to share a quick story of mine from my own personal experience. 3 days into having my immediate dentures, I was in the emergency room. Here's what I looked like. I don't know. When I was looking at pictures online of people who had just gotten dentures, I didn't see anything like that. Like, I saw women with their makeup done on day 3 and they're like going out, and I thought that there was something wrong. I mean, that looks like there's something wrong. So I was panicking. The swelling just kept getting bigger, and I'm like, is this gonna stop, or is it just gonna keep going? Are we just gonna keep doing this? Is my face going to explode? Like, I literally catastrophized that whole thing. And so I went to the emergency room because I was just panicked. And I remember being in triage when she was, taking my vitals and stuff, and she was asking me like, what's going on? I didn't want to come right out the gate and say that, I just got dentures. So I was like, it was from, extractions. I think that's what I said. And she was like, well, how many teeth did you get extracted? And I was like, all of them. And she kind of side-eyed me. I knew she wanted to kick me in the face or something, but she laughed and she said, that's part of the process. That's normal. I remember before I even went to the emergency room, I was on like a denture community, and I was freaking out, and I was saying, something's wrong. My dentist did something wrong, and this whole thing is just wrong. And I was wrong. That was completely normal. So I did it too. Here's something that's normal that's not on my list. Anytime you do something new, you have like a heightened awareness, if that makes sense. Like, think about the first time you rode a bike or drove a car or went to a new country. Your senses are all very heightened, especially if you already had a lot of anxiety prior to getting your extractions. I mean, everything is all kind of chaotic right now, and it's super easy to get caught up in those emotions and catastrophize things that are normal. Just keep that in mind in the beginning when you're ready to throw in the towel. You're gonna be on edge for a little bit until you get into a routine, until you start getting used to things, which is why it's so important to watch these videos, join a forum, join a community online of other denture wearers where you can get that reassurance of pretty typical experiences. Now, everybody's different. Everybody's gonna have slight variations. There's some commonalities with all of us when we get dentures. So before I get into it, I want to thank Ivoclar Vivadent for sponsoring today's video. Ivoclar is a dental manufacturing company that produces a lot of products that dental professionals use to treat patients like us. So if you want to learn more about their company, visit the link in the description box. Okay, so one of the things you're going to notice is that, your mouth is going to produce a lot more saliva. I was a drool bucket. It was really bad. And it makes total sense because when you have some kind of foreign object in your mouth or even food, your body's conditioned to produce extra saliva in preparation for digestion because it thinks that there's food coming. But what it doesn't know is the difference between dentures and like this. You could have anything in your mouth and it's just the way that it is. When you eat hard candy, when you're chewing gum, you produce a lot of extra saliva. And then after you're finished eating the candy, it goes back to normal. But guess what? You've still got these things in your mouth for extended periods of time. And that's gonna take some time for your body to adjust to this being an almost permanent fixture in your mouth. The worst of it should subside, in a few weeks. Sometimes it could take longer, but it's completely normal. One of the things that you can do to kind of mitigate that is to make sure that you're staying hydrated. And I know that that sounds a little counterintuitive because you think, okay, more liquid, how does that help? When you're dehydrated, it actually signals your body to produce more saliva. Make sure you're getting enough water to drink. Facial bruising and swelling. Yeah, That's normal. And honestly, the bruising on my face, like the swelling was really bad. For me, the swelling, like I looked like a gopher. The bruising for me was more of a yellowish color, but I've seen people who've had bruises under their eyes, bruises on their cheeks, like actual purple bruises. And from everything that I've read online, that's also normal. I mean, yeah, you want to report those symptoms to your dentist, give them a call, explain what's going on, get reassurance. But a lot of people do experience bruising to some extent, and that could be because of like the trauma of the extractions, or you know, whatever other work you had to have done, or just the pressure from the dentures being there. One of the things that you can do to help with that is use cold packs. I remember in preparation for my procedure, I went and got frozen peas. It's very moldable. At one point, I think that I had 2 bags strapped to my head. I had a bag on each cheek, and I took the sash to my bathrobe and I tied it around my head, and it really helped. Also follow the aftercare instructions from your dentist. Sometimes, you know, if the swelling and stuff is significant, there's certain medications that can be prescribed to, you know, minimize that and reduce the swelling. So just check in with your dentist for any kind of major swelling and bruising, but it does happen. Another thing that's normal is that your face is probably going to ache. I mean, this is, again, all new. Your muscles are not used to having those dentures in, and you're gonna find that it takes learning how to use those muscles to keep the dentures in place, to eat properly, to speak properly. That can kind of be a little bit exhausting, even smiling. If you're anything like me, then you probably went a long time without smiling super big. And when I actually started smiling a lot more, my cheeks were constantly aching and sore. Think of those times when you're hanging out with your friends and family and you're laughing so hard you can't breathe and you have to like stop because it's like, oh my God, my cheeks are hurting. It's like that, and that's normal, and you'll get used to it over time. One of the things that can help with that, obviously, is just like a little cheek massage. Extraction site pain is also normal, and that can last until they fully heal. Sometimes it feels just like a ache, like a persistent ache. Those sites are open, they're raw, they're exposed, there's a lot of nerves in there. So a certain level of pain is normal. Now, I don't know if this is still recommended, but for me, I was told to do saltwater rinses to help promote healing. You definitely just want to check with your dentist to see whatever they suggest as far as managing the pain. Make sure that you've already discussed the pain management plan beforehand. The medication that I used to manage the pain after extractions was just ibuprofen. It was just high dose ibuprofen, and that helped for me, and I slept it off. You know, the first 3 days I just kind of slept through it, and then in that first week things were still pretty sore, but moving into week 2 is when everything started to kind of subside and feel a lot more manageable and normal. Just, you know, very mild aching. Difficulty speaking, completely normal. I've heard stories from people who have had just one single tooth replaced, just one, and it's the change is so slight and so minor, but any small difference in your mouth is going to kind of confuse things. It's gonna take a little bit of time for your mouth and your tongue to get used to the new position of everything in your mouth. And this could last anywhere from a few days to a few weeks. There will still be, in the first year at least, where you might run into issues with pronouncing certain things. One of the things that I did to help me with that was just, I would sit at my computer and whatever I was reading, because I read a lot of news and articles and stuff like that, I just make sure that anytime that I'm reading it out loud, and I'm slowing down and taking time to pronounce things properly. That helped me tremendously. I know it sounds a little bit too simple, especially when you're slurring all over your words, but trust me, the more that you practice and slow down, the better you'll get, and you'll most likely be back to talking like yourself in no time. Eating is definitely difficult. I'm gonna put this little clip over here. Can I split screen this? This is hilarious. Here's the problem. There's too much gum action. It's too much. There's too much in my mouth. I can't, that's about as much as I can open my mouth. I can't fit food in my mouth to chew. I can't put a spoon in there or anything. I was so over it. I've just thinking back, because that's been like what, coming up on 14 years since I had, you know, my extractions and got my dentures. And I can laugh about it now, but that was so real to me then. I couldn't wrap my head around, how am I supposed to eat with these? I didn't, like, I knew you get a reline to get them fitting properly. I didn't know that relines could actually set them up further in your mouth and create more space. Like, I didn't understand how all of that worked. So I was super confused as to how it was going to be possible for me to ever enjoy eating again, because it just felt like nothing could fit. Nothing but the dentures could fit. That's completely normal. But then on top of the fact that you've got this, you know, these hockey pucks in your mouth is what it feels like, honestly, you have to learn how to utilize your muscles in a different way when you're chewing. And that takes time and patience and practice. It just does. In the beginning, you're probably going to be told that you need to get on a soft food diet, especially, you know, when you've got open wounds in your mouth. So stock up on soup. Soup is good. Mashed potatoes, scrambled eggs, those are soft. Baked fish, you know, just start out with really soft foods and then gradually reintroduce more difficult foods to your diet. I would not recommend your first attempt eating ribs to be at, you know, a super important barbecue, like work barbecue. Start with fish and then go to chicken. If you have a different diet and you don't eat meat, then, you know, obviously you're not gonna wanna come out the gate eating salads. Start off, you know, maybe overcooking your vegetables slightly, because if you do too much, you might overwhelm yourself and then you're gonna get frustrated and you're not gonna try. Gag reflex, it can happen. In the beginning, you're gonna need several adjustments to make sure that they are fitting the changing environment of your mouth, because remember, as your mouth starts to heal, and then just by not having teeth in your mouth anymore, things are going to shrink. It's going to change. The dentures are not going to fit properly. And so maybe at first it was fine, but then as they got loose, maybe they started going back and hitting that soft upper palate and triggering your gag reflex, which it does happen. It can happen in the beginning. So, I mean, just check in with your dentist and see if there's any more adjustments that could be made. Typically that should subside, you know, about a couple weeks in as you get used to things. Definitely if you're still gagging after, you know, you've had a reline, then more extensive modifications might need to be done. But in the beginning, it's completely normal. Okay, so let's talk about what is not normal. Extreme pain is not normal. Now, everybody's threshold for pain is different. So for one person, what feels relatively mild might be considered extreme pain to another person. So you just want to keep that line of communication open with your dentist. But if it's like unbearable pain, that's a sign that something might not be right, especially if you've got other symptoms that could indicate, you know, a possible infection, because sometimes those open wounds can get infected if they're not kept clean properly. There's also the potential for dry socket, and that's not fun at all. Anything above like the typical aches and pains, you need to be reporting back to your dentist. Persistent sore spots are not normal. Yes, sore spots will happen. For me, in the very beginning, I think it was the week leading up to my first reline, they got very, very loose. They were rubbing. It was painful. And I did develop sore spots. Sore spots are just basically the friction from your dentures rubbing up and creating red, tender spots on your tissues. They're kind of like raw spots. To me, it felt a lot like a canker sore. And that's normal when the dentures aren't fitting properly. That typically does happen, but that just means that it's probably time for you to go back and get adjustments made and get your reline so that the dentures are fitting properly and not rubbing. You definitely don't want to think, oh, well, this is just a normal part of having dentures, because those raw spots can become infected and that can create a slew of other problems. Difficulty chewing and eating after the adjustment period, you shouldn't be putting up with that. It could mean all kinds of things. Like it could be that the bite is off, that, you know, the dentures are just not aligned properly. Something else could be going on, because a good fitting denture, a good quality denture, you shouldn't have any problems eating with them. And I get a lot of comments from people who say, I can just never enjoy food again. And that's not normal. That's not normal. The whole point of getting dentures is to return your quality of life to you so that you can enjoy foods again. Yes, for some people, it's going to be more difficult than others because just the anatomy of their mouth is different, and eating with those dentures might be a little bit more challenging for them. I often use the example of my mom and I when talking about that because our experiences were completely different. But then again, our mental state was also different. She got very frustrated and didn't want to practice, and to her, she was just like, you know what, I'm happier without dentures, and that's fine. If that's her decision, that's great. But I was absolutely determined to make it work. But you shouldn't be accepting the fact that your diet is just not going to be the greatest from here on out just because you have dentures. Because if you stay on my channel long enough and look at the comments, you'll see that for everybody that can't eat properly with their dentures, there's like 10 more that can. So please don't accept that. Get back with your dentist or go find another dentist that's gonna make you a better set, or at least figure out what's going on, because there could be other things going on. Chronic bad breath and a bad taste in your mouth, not normal. I hear denture breath getting tossed around a lot online, and it's like, but why though? If your breath is smelling really bad, it could indicate an infection or that you're just not cleaning your dentures properly, because that should not be a thing. I mean, really think about it. You have the opportunity to take these things out of your mouth and meticulously clean them, probably even better than your natural teeth, because you're not gonna miss anything. Like, you can inspect them under a magnifying glass and get every little thing. Soaking your dentures is important. That's a necessary part of the cleaning process because dentures are acrylic, they're porous. There's all these microscopic little teeny tiny pockets in them if you were to look at them under a microscope, and that is where bacteria can get trapped, and bacteria is what that smell is. And so if your breath is smelling bad, it's because there's a presence of some kind of bacteria, and it could be that you're just not cleaning them properly. So make sure that you're following the aftercare instructions from your dentist to a T to keep them clean. And if you're still dealing with persistent bad breath, get with your dentist and find out what actually is going on. Also, it's really not enough to just clean your dentures and maybe swish with a little water in your mouth. You should be cleaning your gums. A soft bristle toothbrush and paste, that helps. Some people prefer to use a rag. I mean, when you don't have teeth at that point, it really doesn't matter as long as you are keeping your gums clean, keeping your mouth clean. Even still without teeth, it's so important because bacteria can still grow in there. If your dentures are slipping constantly, despite relines, despite adjustments, they're slipping, they're flopping around, maybe sometimes making clicking noises and stuff like that, that's something that you want to follow up with your dentist about, because that could mean, you know, a host of things. You might need an entirely new set of dentures. It could be things like bone loss contributing to that. For my mom, she lost all of the bone pretty much on her bottom ridge. There was nothing there to hold that denture in place. And so right from the beginning, part of the denture that you would expect to be, where's my bottom dentures? Part of the denture that you would expect to have this, you know, little concaved area there to grip the ridge or whatever, it was like flat here. It was flat because there was like, what are they gonna mold it to? There was nothing there, there's no bone. And so in those cases, yeah, it's gonna be challenging to keep dentures in your mouth, even with adhesive. Sometimes more extensive work is required, possibly bone grafting. My mom was told that she would need bone grafting and possibly get, you know, at least a couple mini implants in the bottom to hold that bottom denture in. They should not continue after that healing period, which looks different for everybody. You know, it could be, you know, a few months to, you know, up to 12 months is when all of those changes take place in your mouth. Anything beyond that, if you're still having problems with your dentures staying in place and they're still flopping around, that might be an indicator that some further investigating needs to happen and you possibly need a new set of dentures or different procedures to keep those dentures in place. I feel like I shouldn't have to say this, but I feel like I also do have to say this because there's the chance that people aren't aware of the fact that if you do have visible damage to your dentures, if you do have like a crack or something that has compromised the function of the denture, you should report that back to your dentist, because a lot of times those dentures are under warranty. And if you're going around with damaged dentures and causing further damage to them by not getting them repaired immediately, that could void the warranty. And you definitely don't want that to happen. Also, hairline fractures indentures and things like that, that does compromise the integrity of the denture and it can break completely. So if you notice anything that looks suspicious, that looks a little bit off, don't wait to get that addressed. Don't think, you know, oh, I don't want to bother with having to make the appointment. Just do it, get it over with, because you don't want to have what you think is like some minor crack over here, and now you're on vacation hundreds of miles away from your dentist and the whole thing splits in half and now you don't have teeth. Yeah, report any kind of damage to your dentist immediately and get that taken care of. Bleeding gums, not normal. After that initial healing period, after you get your teeth extracted, if you see any kind of bleeding going on, it's not normal. You should not be dealing with that at all. Bleeding gums is a sign that you could have some kind of sore happening in there because the denture's not fitting properly. It could be gum disease. I mean, there are different things that can cause bleeding gums, but it's not something that should persist at all past that initial healing period. So anytime you see blood, report it back to your dentist. So yeah, if you're experiencing any of those not normal signs, call your dentist. Get in there, get checked out, make sure that everything's good. There's some things that I see in the comment section here that people are putting up with that they should not have to put up with. If I've forgotten anything, then leave a comment, let me know. There's always those one-off situations, those off-the-wall experiences that people have, and it's like, I've literally never heard of that, and I know somebody watching has probably had an experience like that, so share it below. If I forgot something that's normal, I'm trying to think, because I know that there's got to be more, but I guess the point that I'm making is that informing yourself is so important. By watching content like this, joining a community of other denture wearers that have experience, keeping communication lines open with your dentist. You know, it's not a problem to give them a call. You're not really bothering them. And if you are bothering them, which I guess for some dentists you could be bothering them, then you just need to find a new dentist, because they should be able to communicate things to make sure that you're okay, because you're walking around advertising their practice and their whole goal is keeping you healthy, keeping your mouth healthy. All right, so I guess that wraps it up. This was a super fun topic to talk about. I can't believe that I haven't done this video before. If you like the content that I put out there, it would be super helpful to me if you hit the subscribe button, like the video, share it if you can. Definitely drop some comments and get dialogue going, because that's really helpful for people who stumble upon this video because they're like anxiety ridden about their new experience as a denture wearer, and you could be that one person that helps ease their fears. We've all been there, right? Anyways, that wraps it up for today, and I will see you guys again next time. Y'all take care.